Hi everyone, welcome to week 6 of Nursing 1000. For your week 6 greeting, I just want to go over some of the more recent assignments you completed and then review what you have coming up for your week 6 assignments. So really quick, let's go over what you did for the week 4 assignment. So you did a discussion board as well as an assignment. The discussion board revolved around the NCLEX test plan. So you had to access the test plan, get into it a little bit, look at the different categories of the test plan and become a little familiar with it. And I know Mrs. Kafis said she had visited one of your classes and someone was like, why are we talking about the NCLEX so much so early in the program? But remember, you start preparing for the NCLEX the first day of nursing school. It's also a great resource that in the past I had 4th semester students who didn't even know it existed. So it's great to know that it's there and be able to check it every once in a while, especially as you get towards the end of the program. And you can look and see if there's content area that you're weak in and really develop your study plan for NCLEX, focusing on your weak areas. Your week 4 assignment was pretty light. You looked at sort of what you had planned in terms of studying, self-care, work, family, all that good stuff. Looking at your study schedule for a week and seeing if you were doing what you had planned to do, if you needed to tweak things, or how things were working with your study schedule. I'll say some students, based on the feedback that I'm getting, aren't studying a whole lot. I wouldn't say everybody, but some responses like, I studied the 3 days before the exam, and maybe it was only asking you to look at 1 week's worth of time. But I want you to know that, or remember, that to be successful, it's going to require almost daily studying in nursing school. So I always suggest you study daily and give yourself 1 day completely off from nursing school. That regular studying is going to help you retain the information, because what you're learning now is the foundation of nursing. So what you're learning in this first semester or second semester for the LPN to RN bridge students, it'll come back. We're going to build upon it. So you really have to master that content. And if you're just doing enough to squeak by and pass exams, how's it going to be in 4th semester when you need to recall that information? It's going to be more difficult, right? So the goal is not to study just to pass exams. The goal is to study so that you know the knowledge, really have a firm grasp of it, and can take that knowledge throughout your entire career. So remember, we're not just studying to pass exams, but we're studying to really learn that content, and that's going to take pretty regular studying. The week 5 discussion board talked about exams and skills checkoffs. That might have been actually where I saw sort of how people had prepped for the exam, and I was kind of surprised at some people who hadn't prepped as much as most students have to in order to be successful for nursing school. And then the skills checkoff, the best thing you can do is utilize those open lab hours and make sure you go in feeling confident. And even if you do, it's not uncommon to be nervous and shaky. It's just a high stress sort of situation with those skills checkoffs. But the better you are prepared, the better you feel when you go in and do those. Then the week 5 assignment was another rewording assignment. And remember, with these rewording assignments, we're just rewording things into 1 sentence or 1 question. So taking what can be at times a complex NCLEX style question and rewording it for ourselves before we even look at the answer options, because that's a great way when you're taking the exam to sort of read through a big complex scenario, be able to break it down, and in your own words reword what the question's actually asking. I'm still getting some assignments where students are predicting what the correct answer might be, sort of great critical thinking and clinical judgment, but going a step further than these assignments require. So the rewording assignments, it's just rewording the question in your own words and sort of simplified. So we'll review a couple of the week 5 rewording questions that you guys did. So for question 1, hopefully you realize it's one that I gave with the instructions, so that one should have came easy to you. But you have a patient or a client with low platelet count, and the question is, the nurse implements which measure in the care of this client? So a way to reword that NCLEX question would be, what is important for a patient at risk for bleeding? So you might have had, what is important for a patient with low platelet count? And that's fine as long as you have that takeaway that they're going to be at increased risk for bleeding. So the second question was, a client was diagnosed with sepsis, an infection that spreads to the blood, causing life-threatening whole body immune responses, and they're receiving a medication. So even if you don't know the medication, that's fine. You can just simplify it for yourself at this stage and say they're getting a medication. The nurse realizes that the client is responding favorably to the medication therapy if which lab result is noted. Now this student answer sort of went that next step. They want to look at the procalcitonin levels to determine if sepsis is decreasing. But remember, this assignment is just rewording. So an example of a way that you could reword this is which labs indicate that sepsis treatment is working. This question described a patient with HIV and planning infection control measures for the client. Which is the best type of isolation precaution that the nurse would prepare? And this suggestion is good. What type of precaution should be used on a person with HIV? Again, they gave some thought as to what the correct answer might be, but for right now, we're just rewording, so that's great, but you didn't have to put it. And this was the last one I'll go over in this recording. So you have a client who had a bowel resection, so a bowel procedure. They're restless, the vital signs are taken, and the pulse is increased and the BP has dropped. The nurse suspects the client is going into shock and would take which immediate action? So a rewording for that question, it does have a significant strategic word in it, that immediate. So if you see words like immediate, priority, first, those words you should include in your rewording, because soon we'll be learning about test-taking strategies to use for prioritization type questions like that. So let's see, it said the nurse suspects the client is going into shock and would take which immediate action? So what would I do immediately for a person experiencing shock would be a fine rewording for that. Or what would I do first? What's my priority for a patient experiencing shock? Those would all work for that. This rewording says, what are the signs and vital signs that we would presume as a shock? But that's not what it's asking. It's saying, what immediate action or immediate intervention would you do? So hopefully that review helps you a little bit in understanding what the rewording activities are asking for. Make sure you look over the rewarding activities that you submitted as homework, because there will be, for our first quiz that's due on Sunday, there will be some rewording activities there. So look over the feedback that you got for previous rewording activities. Make sure you understand sort of what it's asking for so you can get full points on the quiz. And lastly, I want to go over your week 6 expectations. So for this week, you'll want to read chapter 6 of your textbook. And that's important that you're actually opening the textbook and looking at it. I know it's a light course and it can feel like an unnecessary part of the assignment, but there's really some good reinforcement of the things covered in the recorded videos that you need to be looking at and reviewing. So please make sure you're doing your reading. So read chapter 6. You got this welcome video, a recorded lecture about avoiding reading into questions, multiple choice and multiple response questions, as well as some practice math, and then a recording about how to deal with burnout. You have one discussion board about preventing burnout. And remember, discussion boards, your initial post is due Wednesday by 11:59, and your peer response is due Sunday by 11:59. Activity-wise, you have a chapter 6 activity that's due Sunday by 11:59, and then again you'll be doing your first quiz, so a 25-point quiz that'll cover topics that we've gone over so far, and that will be due by Sunday at 11:59 as well. And just a reminder, in order to get points for the assignments, they have to be completed completely by the due date. So in the first couple weeks, I was a little bit more lenient as everyone was figuring things out. But at this point, I think you're into a groove as to what's expected for this course. So if assignments aren't complete by the due date, you won't be able to earn full credit or potentially any credit for them, but you'd still be required to complete the assignments. Also, I've been sending out emails, so if it's like Tuesday night, Wednesday morning, and you haven't done your initial discussion board post, or Saturday or Sunday and you don't have a peer response or your final activity for the week done, I'd send out an email like, hey, just a friendly reminder, those are coming up. Those will cease as well, because at this point I think you got the schedule down. So hopefully you're able to stay on top of those. If you have any questions about anything related to the course or the program, please don't hesitate to reach out. You can schedule an appointment with me. I've sent you a link that you can use to schedule appointments, or shoot me an email if you lost the link and we'll get something scheduled. Have a great week.